I'm Eric Bricker, and I've been a psychotherapist for over 25 years. One thing I can tell you for certain is that no one makes it through life unscathed. At some point, many of us will rely on the trusted counsel of another person to help us navigate difficult times, or to reconcile a troubled past. Whether conventional or unconventional, professional or informal, there are a lot of different forms that helping relationships can take. This podcast is an exploration into what makes these relationships work. Who are the people that help us? How do they help us? What do people need help with? My hope is to uncover as much as I can about this very human phenomenon, and I hope that you'll join me. This is the Good Counsel Podcast. I'm Eric Bricker, and this is the Good Counsel Podcast. Today I am joined by my good friend, Robert Herbst. Robert is a licensed acupuncturist and diplomat in Oriental medicine and co-owner of the Care Wellness Center in Margate, Florida. Robert, welcome aboard, man.
Thank you, Eric. It's a pleasure to be here. I'm a big fan of your podcast. I'm a listener. Been a listener for quite some time, and I really love the content and the topics that you put out. Thank you so much for having me, to inviting me here on the show. I really appreciate the opportunity to come here and talk about what I do at Care Wellness Center. The reason I'm here today, I want to tell my story. I'm a licensed acupuncturist, and it's not something that I ever thought I would be doing in my life. It's an occupation that I just happened upon. It was something that came later in my life when I was in my early 30s. I already had a career. I was in the field of psychology. I have a master's degree in clinical psychology, and I'm working in that field. And I happened to go to an acupuncturist, and it changed my life. I'd like to tell that story if I can, and talk a little bit about acupuncture and how it's could be a really effective and capable adjunct therapy for people in need, for people with addictions, for people with psychological conditions, anxiety, depression, and how well it works with psychotherapy, counseling, and group counseling. So I would like to tell that story.
Sure. So just to kind of frame this for people who might be listening, you and I have been friends for a long time. I've known you for better than 30 years at this
Correct.
point. We were dorm mates in school together, and we were pals. I experienced you as like a really funny person and a cool guy.
Thank you.
One of the first people I ever met that was from the Bronx.
Yes.
That actually grew up there and survived.
Yes, thank you. That is true.
And I also knew, as we became really good friends, that there was a fair amount of suffering that went on. And
there was.
And even continued suffering that went on after school with mental health stuff. You know, it was a tough thing to watch, because I knew that in those moments that you were suffering the most, that there was this whole other person to you.
Yes, absolutely.
That the world maybe couldn't see, or maybe that you couldn't see, and that it had to have been very painful.
Yes, it sure was painful. It was quite a time. I mean, since the time that I met you, I believe it was 1992, I was a freshman. I wasn't a freshman. I was a transfer student from St. John's, and I was in my third year of college, and I met you in the dorms, and yeah, we definitely hit it off right away, and we wound up working together at United Cerebral Palsy. I remember you helped me get a job there, and the funny story about that is you set me up with an interview, and I showed up. It was an August hot summer day, and I showed up in a suit and tie. for a $5 an hour job, and you were like, Rob, I think you were going to get this job no matter how you came and how you dressed it.
Are you here to buy the place?
So yeah, I did get the job. I don't know if the suit was a factor at all, but I did get the job, and we did work together there, and it was a very meaningful time. It was a really great experience. Just to get back onto the topic here, yes, I was suffering. You knew me at a time when I moved here from New York. I was going to St. John's in Jamaica, Queens, up in New York. To go back even further, I was suffering with asthma as a kid, and I was on a whole bunch of different medications. And I'm going back to like elementary school, middle school, and I was on a whole bunch of different medications. Some of them they don't even prescribe any. Marax and Theophylline. Later on, puffing away on like inhalers.
What is Marax?
It was a liquid that I was taking, and it just opened up your airways. But I mean, it really sped up your metabolism.
You took it orally?
Yeah, from being a very small child, I remember taking.
So it was like an oral stimulant that opened up the capillaries and stuff in the lungs.
Yeah, that's what I was on when I was a young boy. And I just remember from very early on, I was always jittery. I was always nervous. I was always tense. I always had brain fog.
You think that was like an effect of the meds?
It was definitely an effect of that medication.
That sounds very strong. It's like liquid amphetamine that you give into like little kids and stuff.
I'm not sure. Yeah, I just remember how it made me feel. I remember how I felt before, and then I remember how I felt on the medications, and I never felt right.
Wow.
You know? But at the time, I didn't make the connection. You know, I was just like, I got to take the medications or I really can't breathe. But I never felt right. And then I moved on to high school, and I did my best to fit in. What happened was, after years of taking these asthma medications, I started to get anxiety attacks and I started to get panic attacks. I was always a really good student, but I was starting to miss a lot of school. I was starting to miss a lot of stretches of school. And nobody really was too concerned because my grades were always really good. I was always a very good student.
So let me ask you a question about that. Do you think it was the medication that was causing this?
I'm pretty sure, looking back at it, and I could tell you because now I do not take any medications, and I feel amazing.
So let me ask you something else. Was there anybody that you knew of in your family on either side that had that kind of anxiety with panic attacks?
I learned later on, yes. But at the time, this is the 70s and 80s in New York, nobody spoke about anxiety. I didn't even know what the word panic disorder was. Nobody went to a psychiatrist. Nobody went to a psychologist. It was just taboo, and you just didn't do it. And on top of that, I didn't even know what I had. I just thought this was who I was, you know? So I'm going to school, and I'm having trouble with interpersonal relationships. I have friends, but I'm just not my ideal self. You know, I don't get along with certain people. I have poor interactions with certain people. I struggle socially. I used to struggle, doing presentations and speeches.
I want to ask you something for anybody who's listening to this, because the word panic attack gets thrown around.
Yeah.
Quite a bit. And there's a fundamental difference between an anxiety attack and a panic attack. And I've talked to you before, and you definitely have the genuine article. You have had, for real, moments of terror that arrive out of nowhere, like real panic. Do you mind describing for people what that's like what happens to a person when they have a panic attack?
Of course, yeah. So just generalized anxiety, I had a lot. Just nervousness, having to go onto the city buses in the Bronx to get to school, walking around different neighborhoods. It was a very tense place to grow up in. There was a lot of racial divide. I had anxiety. Okay?
Sure.
And sometimes I'd have anxiety just sitting in my home, just the fear, nervousness. But panic disorder is something completely different to me. I just feel I would start off with the anxiety, and then it would turn into just a rush of energy. And this is how it affects me. Just a rush of energy coming up through my chest and up into my throat and up into my head, where I feel like I'm going to explode. I feel like I'm going to vomit. I feel like I'm going to pass out. I have trouble getting a breath. And I have to extricate myself from whatever situation I was in. So it was definitely a struggle. When I got to that point where it was panic disorder, that's when it was super disruptive in my life. And that's when I would miss stretches of school. But like I said, I was still getting B pluses and A's. And my mother was like, "Oh, he's staying home, but he's still doing really well." I wouldn't understand it.
I have to imagine experiencing something like that and not knowing what that was and just having it arrive out of nowhere. The fact that no one could really explain it because people didn't really talk about it, that must have been terrifying.
It definitely was, because I knew there was something that was not right. I knew there was something wrong. I couldn't articulate it. And if I said, oh, I was nauseous or I threw up, my mother would take me to the doctor and they would do tests and like, no, it's not this. It's not that. It's not this. And in my head, I'm like, I know it's not that.
No one put together that like,
no,
it could be the speed that you're taking.
No, because I needed them. You need to take it. You need to take the asthma or you can't breathe. So, and
they didn't have the inhalers and all that back then.
Okay. So then I in high school, I started the inhalers and they were equally as bad because, I'm living in a very cold environment for most of the year and a very polluted environment. Everybody's cigarette smoking back then, on cars, on buses, on planes. Everybody is smoking back then,
Absolutely.
Right?
Both my parents were smokers.
Yeah. Every allergen under the sun I was exposed to 24/7, pretty much. Mold, dust, cats and dogs, everything that I was allergic to, and including the food. I was just surrounded by it.
Mold, dust, cigarette smoke, car exhaust, hatred, all of the pollutants.
Yeah. And it turned out I had an allergy to tomato, and I have an Italian mother. Who was consistently making pasta, and I absolutely love pasta.
I've had your mom's pasta before. I've come over for Sunday dinner with pasta and gravy and the meatballs.
Yes.
It's memorable, dude.
Yeah, thank you. Yes. Yeah, my mother was a good cook, and she always loved having my friends over, such as yourself. But yes, I was surrounded. These allergens were everywhere. So I'm puffing away on all this. I'm having anxiety attacks. I'm having panic. And at I think junior year in high school, I missed so much school, but I was able to not only pass. I got good grades, you know. So I went on, and the funny thing about it would go away for stretches of time. You know, like I would feel like something had lifted and it was gone. But then it would come back. It would come roaring back. So now I'm 17 years old and I'm a freshman in St. John's and I'm trying to adapt to college.
How'd you get into college at 17
years
old?
I was born in December and I made the last cut so when I was a senior in high school, I started out at 16, turned 17 in December, and by the time I was in St. John's, I was 17 as a freshman.
17 years old, starting St. John's in New York, which is a college that has a really great reputation. It's a very well-known school, especially with criminal justice and psychology and things
that was my first major, criminal justice.
What were you going to do with that? You in law enforcement or something?
I was definitely interested in law enforcement or law.
Gotcha.
And that was what in the beginning. That's what I wanted to do. It evolved into other things: psychology, social work, acupuncture. But yes, that's where I was, and I was really doing well. And I started off doing extremely well. I was getting great grades, and then all of a sudden I hit a wall. And I started to get nervous again. The panic attacks came back. It got so, and the reason it came back, there was some stressors in my life. There was things happening outside of school, some things beyond my control, some things within my control. But I wound up getting full-blown panic attacks again. And it got to the point where, I'm a junior at St. John's, and it got to the point where I couldn't continue anymore. I wound up leaving. I'm not gonna go back for the second half of junior year. I'm not gonna go back. I'm going to take a break. I'm gonna wait till this passes, and then I'm gonna go back. So long story short is I never went back. I took a good 2 years, year and a half, 2 years off, moved to Florida, and that's where I pick up where I'm at FAU. And I'm starting over. Okay, but let me just backtrack one, because I missed one thing here. Is that when I was in St. John's, this was an epiphany here, because this is how I found out what I had. I took general psychology at St. John's, And the professor was very dynamic guy, very articulate, great storyteller, and so interesting and so fascinating. And I loved the class. And as we moved along the curriculum and the syllabus, we got to the chapter on anxiety and panic disorder. And I'm listening to him and I'm reading the chapter and I'm like, oh my God, this is what I have. This is what I am experiencing. This is what I had started to experience again at St. John. I'm like, it's coming back and this is it. And it gave me such a sense of relief that I figured this out, right? But I'm like, well, what do I do with it now? What do I do with this information? This is what I got. Who do I go to, So it got really bad and the semester ended, and that was the semester I took psychology. And I left. I'm like, I can't go back, but the good news is I think I know what's going on and I need to get help. And what happened is that I just did more research and I'm like, I need to go to either a psychologist or a psychiatrist.
So this is early 90s at this point.
This is, yes, I think it was 1990. Yeah. And I wind up deciding that I'm going to I was making phone calls. I'm like, I'm going to go to a psychiatrist. I'm not going to tell anybody. I want to go and talk to him. I want to see what he has to say. I'm going to tell him exactly what I'm feeling, what I know, and I want to see what he says. So I wind up, I find somebody in the yellow pages and I go, I call the guy, make an appointment. I go, I use my own money. I don't use my insurance because I didn't want my mother to find out. Or my father, and not that they wouldn't have been supportive. I didn't know how I felt about it, and I know that there was at that time there was a stigma for people who were going, to see a psychiatrist. So I'm like, let me just explore this on my own and see where this goes. So I went, and the guy was great. He was really good, but what happened is he gave me medication. He gave me something called Tofranil, which I'm not sure they even use anymore. I don't know what kind of but he explained that antidepressants block panic attacks.
That's before SSRIs.
Yes, it definitely was. Yeah, they weren't available at that time. No. So he gives me that medication, and he gives me Valium. I start taking the Tofranil, and I don't know if it was the placebo effect or what. But I almost instantly, I'm like, oh, I feel really good. Panic attacks are blocked. I'm fine, And I felt pretty decent for a while, So, but I noticed that there was side effects to the medication. I was taking it for less than 3 months, and I had gained 40 pounds, and I was eating constantly. I remember going to a Chinese restaurant with my parents, and I remember eating 3 entrees. I'm sitting there and I ate 3 meals, and they're like, what's going on?
What'd you get?
Mongolian beef is always my first option. And I may have had Szechuan chicken and Hunan pork, I think was the third one.
3?
Yes, I ate
3 meat entrees.
Yeah. And I inhaled them. That's how.
In fairness, Chinese food in New York is some of the best in the world.
It is. It's amazing. It's amazing.
That's where Chinatown and all that.
Yeah, and we used to go to some really, really great places.
In fairness.
Yeah. So I don't know if maybe it was justified to eat 3. I'm not sure.
Well, it sounds like a deadly combination of antidepressants and amazing world-class Chinese food. I feel like anybody in that situation is kind of hopeless.
Yeah, but I was a balloon. I was always a very, kind of a slim guy, slim build. And all of a sudden I was really packing on the pounds, and everyone was noticing. And I'm like, I can't keep this up. I can't. My appetite was absolutely voracious. I couldn't contain myself. I could eat 12 Lego waffles in one sitting. I could eat a whole box of cereal. It was insane. People were like, what the hell is going on with you? You were always this very thin, slim, athletic guy, and you're just, you're ballooning up.
How many Eggo Whops?
There's 12 in a box. Yeah. And I'm telling you, I ate a whole box.
Syrup.
My mother worked in a bagel shop. She'd bring home a whole bag. I mean, I was eating constantly. And I'm like, I gotta, so so at this point we moved to Florida and I'm like, I gotta find a new psychiatrist. And I gotta tell him I gotta come off of this medication, So I wound up seeing a doctor here, and he's like, "Yeah, let's come off that." And at this point, there was something called Prozac. The SSRIs were there, and he put me on that.
Which I'm pretty sure Prozac is still currently first line for generalized anxiety and panic attacks.
It definitely is. So I moved off of the top. I went to the Prozac. I lost the weight. I lost the weight, thankfully, rather quickly. But I did notice that medications were not working for me because I went through a whole litany of different medications: Zoloft, Paxil, Prozac, Effexor, just one after the other. And I was just having really bad side effects to a lot of them. I couldn't tolerate the Valium. It made me
bad news.
Yeah. And I also noticed by this time, I was moved off of the Valium and I was on Klonopin, and I was abusing it because it made you feel really normal. When you feel the way I was feeling for such a long time, sadly and unfortunately, that medication and alcohol made you feel normal temporarily. And that is a deadly combination.
That's a trap.
And it led me down a really dark path.
That is a trap a lot of people get into because any benzodiazepine drug that you take, whether it's Klonopin, Xanax, or Valium, they're all addictive drugs. They all foster dependency.
Yeah.
And Klonopin is known to be probably the least of them. Right. But it's still addictive.
It certainly
and
is.
If you're taking it as a maintenance med every day, you're going to develop a dependency on it.
Yeah.
Which means if you ever try to get off of it, or if you ever miss doses, you're going to have withdrawal symptoms.
Yeah.
Plus the exacerbation of the effects of alcohol, right? It's considered, there's a name for that. It's considered synergistic, meaning alcohol will
intensify
the effect of the Klonopin, and Klonopin will intensify the effect of alcohol. So it's not 1 + 1 = 2, it's 1 + 1 = 4. So, and you're essentially at this point, it sounds like self-medicating with alcohol and abusing the Klonopin.
Yeah.
So short-term relief, but most people I know who've experienced that in the long term, a lot of problems.
Yeah, well, this is the time when I met you, and I was in a phase where I was using both together to socialize because I couldn't do it normally because I wasn't socialized properly. I didn't know how to. I never felt good,
So when we were going out to like parties and hanging out together at like bars and different things that we're doing, college kids, you actually had to make these preparations to go do those things.
I had exactly.
You'd have to take a couple of Klonopin, have a couple of drinks just to get you in the door,
right? So
that you could be around people,
right? Yeah, and I felt more sociable. I felt like I was myself. And honestly, I wasn't. I was probably grossly inappropriate at times. And
no, you were great, dude. You were great, and you were one of the funniest people I knew. And that actually is what made your suffering such a shocking surprise to me when it started to come out.
Yeah.
So, quick story for the audience because this is phenomenal. So you and I were actually we worked security. We worked the door at the bar on campus at FAU. It's called the Rathskeller. We called it the Rat. And so we would go there and it was a cool job if you worked on campus and stuff, lived on campus. So one night, and it was probably like the busiest night at the Rat. It was like there was a party going on there. So like the whole school was there.
Mm-hmm.
Probably like 200-300 people packed into this bar. And next door is the FAU auditorium where they have a lot of, shows, like live music and performances and orchestras and things like that for the audience. Right. We live in Boca Raton, Florida, big elderly population here, so it caters to that kind of demographic. So we're there, and again, 200-300 people in the bar, and I'm trying to do my fake bouncer thing, with my security shirt and like my flashlight, walking around like I'm running shit. And there's all of these people. It's like reggae, I don't know, whatever. It's like some big party going on. And then from the parking lot, I hear, it was my mom and like 3 of her friends.
Yeah.
And it was that moment where you just hear that and the music stops.
Yeah.
Like 300 people are just staring at you like you're trying to be cool, and your mom just showed up to this thing. I was my face turned red. I was like demoralized, right? And you were super cool about it. You didn't say anything. You were like, it's all right, man. I think you actually said hi to my mom or whatever. Like you were really cool about it. You didn't embarrass me like everybody else did. And then when it was all over, real low key, you're like, hey man, I guess Wednesday night is reggae night. Are you working? And I'm like, yeah, I think so. And you're like, oh, cool. Is your mom coming to that too? which was great, and I even though the joke is on me, I thought this is the funniest thing. So when I think about you at that time, you really had this way of masking what was going on with you to where people around would not have known that was what was happening, because you were doing the same stuff as the rest of us.
Yeah. I did a pretty good job of hiding it. I did a good job of hiding the anxiety, hiding the abuse of alcohol and the abuse of the benzodiazepines. But at some point it would catch up to me. What happened after that is, we went on, it took me a long time to graduate. I felt like I was in school for a decade, and I just got my bachelor's degree. It was 1995. I started in 87. I took it really slow. It's just like I would take 6 credits, 9 credits, work part-time. It's all I could handle. So it took me a while to get to the point where I finished my bachelor's, and I'm like, I gotta go to grad school now. I gotta figure out what I'm gonna do. And I was very excited. We both were always interested in psychology from way back. We worked at United Cerebral Palsy together in Boca. I knew that you wanted to move on and pursue that as a career, and I did too. And I was very excited that I got accepted into a graduate program, a school in Miami, and I was very hopeful, and I started the program, and I was doing well. And then once again, I at this point, I stopped taking medication. I stopped taking antidepressants. I stopped taking benzodiazepines, and I was just trying to navigate my way through life without all that, because there was just too many side effects. And it did take me a while to get off of the Klonopin, the benzodiazepines. I guess, for the next few years, I'm struggling. I have periods where I'm doing okay. I'm struggling. I'm still, one thing I never shook was the drinking. I continue to drink. It continued to be a problem. And then as time moved on, it was really becoming an issue for me, and I came to a point where I was destroying relationships, and I was missing out on opportunities. I was hurting a lot of people that I loved. I was disappointing people that I loved. So it was like another cycle. It was like St. John's, FAU. Now I'm in graduate school, and now I got to the point again where I left. I left after I got my master's, and I could have went on. I could have went into the doctoral program. I could have advanced. I had a great opportunity to do that. And I dropped. I left. I left the school. I had to leave. Like I couldn't continue any longer. I felt a lot of shame. I felt disappointed in myself.
That must have been really hard to come that far.
Yeah.
When you've already sort of struggled with these problems, had to drop out of school, limit the time, the course load, and then you finally get there and you're in graduate school and you get to this place, and once again, it's just not manageable. I can only imagine how hard that must have been.
Yeah, because after while I'm in graduate school and I'm excelling again, I'm doing amazing. I'm doing really, really well, and I'm like this time it's gonna stick. This time I'm gonna feel good. I'm gonna be able to finish this. I'm gonna be able to realize the life I'm supposed to be having. You know, when I started to deteriorate again, I was extremely disappointed. By this time, I was very, very self-destruct. I said I was destroying opportunities, and I was hurting people, and I was disappointing people. And I realized that I had to stop. I had to stop school. At this point, I'm like, this is going to continue forever. What do I do from here? And I remember, and I believe it was a few years went by. You know, I was working, but I wasn't fulfilling. I wasn't doing what I wanted to do. I was feeling awful. I was having debilitating brain fog. I had problems with fatigue, and of course I was functioning, but I was still drinking heavily at night. It just culminated in a point where I just was total despair and total disappointment. You know, you wonder if you even want to go on anymore. You know, you just really feel like, is this everything? Is this all there is for me? I get in relationships, I fall in love, and I destroy the relationship, destroy it. Just disappointment. And I think it's 2003, and I'm moved back in with my parents. Was drinking for an extended period of time, and I got to a point where I'm like, something has got to change. I have to do something different. Something has got to come in my life that's going to facilitate some type of change. I had moments throughout my life where, for a brief period of time, I would feel good for 24 hours. And I was just like, yes, this is how I'm supposed to feel. If I felt like this every day, I could be an absolute force if I felt like this. And I didn't want to go to bed at night because I'm like, I know tomorrow morning I'm going to wake up and I'm not going to feel this anymore. And that's how it was. But I'd have periods of clarity and inspiration, and I'm like, oh man, if I could only feel like this. What do I have to do to feel like this more consistently? And so I broke down in my parents' house. I was on the floor sobbing for almost 45 minutes to an hour, and they were just, they were there for me, like they were always there for me, always understanding, always unconditional love, always telling me how great I was, how wonderful I was, what I was capable of, not to give up. And in that moment, I visualized me feeling like I should feel. And I attached that emotion to it of, what if everything was clicking and I felt good? What would that feel like? And I felt that. And just I had an overwhelming sense that something was coming in my life that was going to make a difference. I've tried many things over the years, and psychotherapy was one of them in my 20s. And I had a great psychotherapist. And it wasn't until years later that I realized just how awesome she was and how much I learned from her. Because while I was going there, I didn't think I was getting anything from it. But really, it all culminated and it all came together at one point in the future. And her name is Jody Jacobson, and she's in Boca Raton, and she was a very young therapist at the time. I think she was a little bit older than me, but she was young. We were in our 20s. And she helped me tremendously, and I'm so grateful for her. I break down in my parents' home. I'm like, I'm going to make another attempt at sobriety. I'm going to go back to AA. I'm going to go back into 12-step. I'm really going to try and embrace it. And I feel like I'm going to get the help that I need. At this point in my life, a very dear friend of mine, her name is Kristen. She reaches out to me. She knew me. She knew my predicament. She says, I'm going to acupuncture. I'm going to my sister-in-law's acupuncture practice, and she practices in Boca Raton. And I think it's awesome. Did you ever hear about it? What do you think about it? Do you want to go with me? And I was just like, acupuncture? And I'm thinking, and I remember like seeing it, like maybe in a Steven Seagal movie or something like that, or on the evening news. And it just looked like they were putting in like 2-inch needles in someone's back, for back pain. And I was like, how could that possibly work? And just dismissing it. And if somebody ever said to me when I was younger, acupuncture, I'd be like, I'm not interested. But what she said at the moment made sense to me, and I was like, yeah, I'll give it a try. I'll go with you. I went to see this acupuncturist in Boca Raton, and when I left there, my life was changed forever.
One visit.
One visit.
One visit and something.
Well, yeah, something clicked. I had thrown my back. That's why she initially said, why don't you come to acupuncture? But she knew that it could do more for me than just help my back, right?
How do you explain something like that? That immediately the use of the acupuncture technique had this impact on you?
Well, it wasn't just the treatment alone. It was the experience. It was a person that sat with me and for the first time really, really sat down and asked me the pertinent questions and listened to me and made me feel like there was hope and made me feel like I can help you. This is a type of treatment. This is a type of medical model where we're trying to find the root cause of what's going on.
So there was a whole relational dynamic going on too with the practitioner who was talking to you, listening to you, understanding you while they're administering the treatment.
Yeah.
And that part of it, therapeutic.
It was warm and compassionate. And I felt like this person really wants to help me. This person really wants to help me figure this out. Doesn't want to just give me a medication and say, try this for 30 days. And it was mind-blowing to me because after I did leave that day, my back felt better. But she's like, I want you to come back here because I want to work on the other stuff that's going on.
What else did you guys do?
Every time we went, she would talk to me. She would do her diagnostic tests that acupuncturists do, like tongue diagnosis, pulse diagnosis, ask me a lot of questions.
Can you tell me what's a tongue diagnosis?
So an acupuncturist would look at somebody's tongue as a diagnostic tool, as something that they use as just one tool in their toolbox to try and figure out where there's some type of pattern of disharmony in you.
Give me an extreme example of when you look at a tongue, you're like, oh my God.
Yeah, so a tongue is supposed to look pink. It's not supposed to be very pale. It's not supposed to be very red. It's not supposed to be swollen. It's not supposed to have a very, very thick, greasy coating on it. It's not supposed to have cracks on it. Well, as an acupuncturist, and what she was looking for was different markers on the tongue. Was it swollen? Is it very pale? Is it very red? Is there a very thick coating on it? You're looking at sections of the tongue because the whole map of the organ system can be placed on top of the tongue as a template. And if you see a marker in a certain area, like the sides of the tongue are the liver and the gallbladder, and the liver is the major detoxification organ in the body. If you see that it's very red or it's very swollen on the edges, you can say, okay, there's probably a deficiency here. There's probably some type of the detoxification processes are probably compromised. But you just use that as one marker. And then there's a lot of, you're going to feel the pulse. It's something called pulse diagnosis. There's a lot of other questions to confirm that. So you don't just look at one thing and say, your liver is not working properly. You're not detoxifying properly because of this. It's part of a set of symptoms. And we're looking for patterns in the body, right?
Once you start treatment and you get this relief on your back, now you're going into all these diagnostic protocols because she wants to figure out what's going on with you that might be causing this anxiety. Yeah. So let me ask you this. Was there ever a specific thing from the other diagnostic tools, the tongue, the pulse, the other things that she looks at, where she comes to you in a somewhat conclusive way, like, hey, I think this is what's going on with you. I think this is where the problems might be?
Well, yes. So she takes a look at my tongue, and it's a complete mess. It's red. It's looks like a slab of steak. and it has a thick, very thick coating on it. Okay. And, the sides are very swollen, and she's feeling my pulse. It feels like a guitar string. It's very wiry and tense, right? So that's another signal that your detoxification system is not working properly. And then she sees the tip of the tongue. She sees a lot of anxiety. You see insomnia, very red, right? Tip of the tongue, very red. Again, there's markers on the pulse. And then there's just a series of questions about your energy level, your emotions. How often are you experiencing anger or worry or sadness? All of these make up for her trying to figure out where is there a disharmony in my body, right? She gives me a lot of direction and a lot of instructions on, I'm telling her that I'm trying to stay sober, and that's the first step, is to really just stay sober. The next step is to really just start eating better, eating more healthy, taking out processed foods and trans fats and sugars and junk food and soda, and replace it with all healthier stuff. Okay, so this is part of just a whole holistic model, and it's not just the acupuncture alone, but the acupuncture is super a powerful medicine in and of itself. If you combine it with lifestyle modifications, dietary modifications, and other things, let's say we're talking about addictions, psychotherapy, 12-step programs, group counseling, EMDR, like nowadays what you're using. But all of that together can work to help someone bring balance back into their body.
Because in addition to being an acupuncturist, there's also the medicine part of it.
The herbal medicine, yes. And that's something that she gave me an herbal formula that helped detox my liver. My liver enzymes were high. So she was spot on. My liver was in bad shape. I had a fatty liver, and it showed. And she's like, we gotta correct that.
So let me ask you a question, because you're seeing people all the time, because now you're a practitioner and you've been doing it for a while. What does the tongue of an alcoholic generally look like to you?
Yeah, it's usually very red and swollen and a thick white or gray coat. So when it's pretty advanced, you can grab 10 people off the street, and everyone will have some marker, and no one ever has perfect. But when you see someone who's very toxic and abusing themselves and eating very poorly and drinking, doing drugs, the tongue is usually going to look like a mess. That's a starting point. There's a lot more. But anyway, this was the start of something special. So I walked into that acupuncturist office, and after a few treatments, I'm telling you, I started to, not only did it made it easier to stay sober, because it greatly reduced my cravings. It greatly leveled me out in terms of emotions. I didn't have the ups and downs.
Which of the treatments do you think is primarily responsible for that? Is there like a protocol for people with alcoholism?
It's funny that you say that, because there is a specific protocol for it. It's called the NADA protocol, the National Acu Detox Association. And believe it or not, it started in the Bronx, New York at Lincoln Hospital. And they did research on 5 points on the ear that work on the sympathetic and parasympathetic nervous system. And it also works on the detoxification processes in the body. So there's really 5 powerful points on the ear that make up this protocol, and there's tons of research on it. If you look up NADA, NADA, detox, there's just tons of research on 5 basic points. Okay, so any acupuncturist that treats addictions, you will usually take those 5 points and then expand on them. That's basically what I do, because I use body points plus ear points plus herbs plus lifestyle and dietary counseling, and I do it all in conjunction. And I encourage patients to continue or start psychotherapy, group counseling, 12-step programs, whatever that they may be doing or I think is appropriate. So I think acupuncture is not a standalone medicine to treat addictions. I think it's great as an adjunct and a complementary medicine to psychotherapy and counseling, and then, like I said, the rest of the treatments.
I realized as I asked you these questions, we kind of took you off track of the story that you were telling about yourself.
Yeah.
But if you want to come back to that, so like you're in the middle of these treatments, you got hope now, and you're really believing in this practitioner. and she started you on some of the acupuncture treatments. She's got you eating differently. She's got you thinking about these things. She's recognized the issues with detoxification in your liver, lifestyle changes, and you're on board and you really believe in this relationship and it's working for you. You feel different relatively quickly into the treatment process.
I feel different very quickly, yes. And it's very inspiring and very hopeful. And I keep going back and I'm feeling better and better. And I'm actually getting good quality sobriety where I'm now embracing the 12-step program and the spirituality aspect of it. I'm starting to practice gratitude and I'm trying to help other people. And it just took me away from me being self-centered. It opened my eyes and it's just like, I'm starting to feel good and I want to pay it forward. I want to bring others with me, you know? So I'm feeling amazing. I keep going back. I was going for quite some time and we talked a lot when we went there. It was almost like, you know, like lifestyle counseling. And I said, I'm ready to like try and open a new chapter in my life and find something that I'd want to do and because I feel like I've come to the point where I'm ready to get back on track and figure out what I want to do for the rest of my life. And she's like, well, have you considered going to acupuncture school? And I was blown away. I'm like, oh my gosh, you know, I didn't even think of that.
What was it like for you to have felt so bottomed out and then you get into this helping relationship with this lady who's really taking you to the next level? You're feeling good. You're starting to become helpful. You're looking into having a future. You're thinking about what's coming next because now you have access to the abilities that you always knew that you had. And now you know, I feel that feeling. My intellect is there. My ability is there. I'm inspired and I feel good enough to do things. And she's actually telling you that you could do what she's doing. What was that like to hear that from her, that she actually believed you could do what she was doing?
It felt amazing. It felt really good. It felt, it was very inspiring. It felt, because you know what, I up to that time, I accomplished some things that a lot of people didn't accomplish. I was one of the first people in my family to go to graduate school, you know. I did a lot of things, but I was never proud of anything. I was shameful of everything because of all the, you know, the failures, the quote unquote failures and the disappointments. My self-esteem was very low. My confidence level was very low. And by her saying that to me, it woke me up. I can do this. And I could, from this day forward, I can become the person that I want to be, you know. And it was just a pivotal point, very powerful. Her name is Kim Garisi, and she's in Delray Beach.
Are you still in touch with her? You guys are like colleagues now.
Before COVID, I was still going to see her semi-regularly. She's got an amazing family. Her sister-in-law is the one that brought me there, Kristen.
Oh, that was your friend?
My friend.
That said, hey, I want to introduce you to somebody.
Yeah. You believe that?
She'll help you out with your back and maybe some other stuff.
Yeah. It's amazing people. And I have so much gratitude and I feel like I owe them so much. So it wasn't even a year later that we had that conversation that I was enrolled. I applied to this. There's a school in Fort Lauderdale called the Atlantic Institute of Oriental Medicine. I applied to that school. They called me in to go have an interview. I wore that blue suit that I wore when I went to go to the UC, the United Cerebral Palsy.
Hey, it worked once.
Yeah, it worked once. It's going to work again, right?
It worked once, you know. Don't go away from a winner, you know?
Yeah. And they were very impressed with the suit and tie. And I told them my story, basically. I was like, I told them, you know, who I was and where I came from and how acupuncture, what it did for me. And they're like, yeah, we're always looking for good students and we're always looking for people who want to learn this amazing style of medicine. They came from China. Her name is Joanna Yen. Dr. Joanna Yen, she was a gynecologist in China, brought a whole bunch of doctors here from China. It started the school in the early 80s. You know, real small school, and it developed. Now it's pretty renowned and pretty big school, and amazing woman, very strong woman, and I appreciate her. And she's still alive. She's about 95 years old now. So I enrolled in the school, okay? And just one more thing I wanted to add. So this is 2004. It was about a year and a half after I started acupuncture. I enrolled in the school. It was the summertime. It was that summer in 2004. We were being hammered by hurricane after hurricane, disrupted the beginning of the semester. And I remember we had our power was out for like a week or 10 days. And I walk into class ragged and tired, and the AC wasn't. So I walk in like, I look like something the cat drug in, And I walk into class and I see probably the prettiest girl I've ever seen in my life. And I'm like, I'm going to go sit next to her. And 3 years later, we were together, and now we're raising two kids together. So I enrolled in acupuncture school, and I met my current wife on the first day that I walked in.
Wow.
Yeah.
Sounds like acupuncture really paid off.
Yeah.
Who helped you in your own recovery?
Yeah.
Got a family out of it?
Yeah,
a whole career?
it was remarkable just how much everything was falling into place. And we have, we're raising two kids together. She's an amazing acupuncturist herself. So there you go. I started sobriety, and I started getting serious, good sobriety. I failed a couple of times since then, for some periods of time where I went back and I started drinking, but then I quickly got back on, and then I did it again. And even if it was like for a week and a half or months, 6 months, I got back until finally, about almost 13 years ago, I quit for good. And I don't think I will ever go back to that lifestyle, the drinking. And
How long has it been now?
almost 13 years.
Oh, wow. That's great.
Yeah. That's when a lot of the growth started to happen. I feel like I didn't really hit my stride until I was into my mid 40s, and into my 50s. I got to tell you, Eric, right now, I have never felt better in my entire life. And almost every day, I feel like I'm still evolving, still becoming the person that I was always supposed to be. Acupuncture, in my mind, saved me. And going to acupuncture school and becoming an acupuncturist gave my life purpose. Okay, so now I want to pay it forward. I want to help anybody that was down, was that low as I was, who wants to help, who wants to pick themselves up, who knows they can, knows the person that they are, who they truly can be. I want to help those people get there too. So that's my purpose. That's my mission. I want to pay this forward. And I believe acupuncture is an extremely powerful method. I think it works very well to help people with addictions. You've ever had acupuncture?
I never have.
Okay. The needles are super thin. They're very thin. They're almost hair-like. They're sterile. They're virtually painless. Powerful, potent conductors of energy. The acupuncture needles, their insertion stimulates the sensory nerves in the skin and the muscles. And that, in turn, sends signals to our central nervous system, which starts a whole cascade of physiological processes in the body, including balancing and the proper release of neurotransmitters and hormones in the body. It helps move blood. It has vasodilation properties. You can target specific areas of the body where you want to circulate more blood. It has immune modulation properties. It has a tremendous anti-aging benefits. What it does, and what I think is the key to how it helps addictions and how it helps depression, anxiety, is that it calms the sympathetic nervous system. So it helps reduce your cortisol and your adrenaline, and it activates your parasympathetic nervous system, which promotes calmness, and relaxation. That's the key right there. If you can take the edge off of people, it gives them that impetus where they can feel better, they can embrace sobriety a little bit more. When that starts to happen, when you take the edge off, and I know from personal experience, when that edge comes off and those cravings go away, it makes it a heck of a lot easier to make better decisions. And that's basically my focus and what I do when I'm in the rooms and when I'm treating.
That sounds phenomenal. We're right here in the Silicon Valley of treatment, and there are so many people in this South Florida area that are suffering from substance use disorders, alcoholism, substance use disorders paired with comorbid psychiatric problems. Plenty of people out there with panic disorders and all these different things. So I had a professor, or actually a mentor, once say to me, no matter how severe someone's substance use disorder is, there's always one pathway out of everybody's misery. And it may not be the same as another's, but there's always going to be one. And the trick or the gift is really to figure out what it is for that person.
Right.
And what's really amazing about your story and others that I've heard is that there are these, what you would call random happenstances of chance meetings and chance opportunities that seem in a way random, but depending upon what your spiritual focus is or what you believe about the metaphysical nature of the universe, can we really call it coincidence, or in some way was that meant to have happened? What a lot of people in recovery call these God moments, where they're ready for something to have happen, and then you meet that person that helps bring you home.
Yeah.
And that's what that sounds like to me.
It seemed like everything happened in divine time. I had to go through all of that struggle. I had to go through that, and I had to experience all that. And when it was time for me to find what was going to work, it would come. I would have those experiences to share with others. And I feel like my life played out the way it was supposed to play out. And now I'm here, and I'm 54 years old, and I still have a lot of time left to take very good care of myself the way I know that I need to, and for me to make the impact that I always wanted to make. I don't see it as lost time. I see it as a tremendous opportunity to have acquired all of this knowledge and some of this wisdom, that I really enjoy life a lot nowadays. And I think it's because I know how low I was and how much suffering that I went through. And when I see somebody walk in, and especially young people now, I know how hard it is to get sober and to stay sober, because there's so much pressure, to go out and socialize and meet people. And when you're uncomfortable, it's hard to get out there and do that when you don't have that social lubricant, right? So the key, and what I try to convey to them, is to try to hang around people who are similar situations to you. That's why 12-step programs, that's why I love 12-step programs, because you're getting together with a lot of people who are going through the same thing you're going, and you can really support each other, and you can stay, they talk about the people, places, and things. You can stay away from that stuff when you're around people that truly care about you and that want to see you succeed, and they're not pressuring you into going back out and drinking or doing drugs or whatever, And that's something that try to them understand that and how important that is. And that's something that if I had more strength, I could have done a better job of that when I was younger. It always felt like I was not normal. I had to isolate, or I had to stay with people who were not functioning either, And
Wonder what that says about me, because you and I were friends. Wonder what that says. But
no, but you were not a bad influence on me at all. Other people were. I would go out with other people and I would abuse. When I was with you, we used to go fishing. We used to watch Giants games. We used to go to movies. We used to go out to dinner. But you never pressured me. Never. You were a good friend. You definitely were. There was a lot of people that did not understand and saw, sobriety as a weakness, and try to make me understand or convey to me that, you have to learn how to have just 1 or 2 drinks.
Come on, man. Rehab is for quitters.
Yeah, I mean, there's actually people out there that that are encouraging you to try and have 1 or 2 or 3 and then stop. I'm like, but you don't understand.
Those people are not your friends.
Yeah, I can't do that.
They don't make good friends.
Yeah, and that's why I think I relapsed after that whole story, after the acupuncture and the acupuncture school, is because I thought in my head that I can do this now. I can go and have a few drinks because I feel really good and I'm not going to go back. But that wasn't the case.
Well, yeah, it's the sense that you fixed the problem.
Yeah, but it's not fixed. It's
tricky.
not fixed because I think there's a genetic component to it. There's still that brings back it conjures up those old feelings and those old memories of that crutch, and
some people just metabolize alcohol differently. It just is what it is. But it's amazing how far you've come and what you've done and where this all started, and the things that you've accomplished. And I think that this story would probably be pretty inspiring to a lot of people out there that are still looking for solutions. Still trying to figure it out, because this is a difficult problem to overcome. And so I'm glad that you're out here, and I'm glad that you were able to come in here today and share all this, your personal story and what you're doing and how these tools are actually effective, not only for you, but for other people and people that you're helping. And so I hope that anyone who listens to this that might be struggling or knows someone who's struggling, would take that in and realize there are other alternative treatments that maybe you haven't tried. You're kind of giving up hope on this thing.
Yeah.
So if anybody wanted to get in touch with you or learn more about your practice, because I know we only really kind of covered the tip of the iceberg. You do a lot of different things in there. So if anybody wanted to get in touch with you or find out more about your practice, how would we know that?
You can go to carewellnesscenter.com. That's our website, and we're on social. We're on Instagram at Care Wellness Center. We're on Facebook at Care Wellness Center Margate. But yeah, you can check out our website, or you can follow us on Instagram at Care Wellness Center, and you can contact me through those means. And yeah, we have a multidisciplinary center, and we do quite a lot. Acupuncture, chiropractic, physical therapy. It's a holistic center, and we treat people very, very well in there. And when there's so many great people, and there's so many great physicians in there. My focus is to just make connections with people, listen to them, like the acupuncturist I went to. Listen to me, make connections. Truly understand them, and to show them that I want to help them. I want to help them, and we can figure this out together. So that's
you.
That's me today.
That's awesome, man. Well,
again,
thank you for coming in and doing this. I think this is great, and I hope people hear this.
Thank you so much, Eric. I just immense gratitude for inviting me here and for me to be able to tell this story and to get this message out. I really appreciate it.